So if you work on a unit in which you have to take care of what we term in the nursing world totals, these are individuals who are pretty much bedbound. They're unable to eat on their own. They're unable to kind of let you know when they have to go to the bathroom. So you have to perform total care on them. I have some pointers for you to help you adequately and successfully take care of these patients. It can be difficult, but these are some hacks that I currently use. But I want to share kind of some tips that will help you make caring for them so much easier, and it actually will be an enjoyment. So when you have a patient, primarily a lot of times when that patient is being admitted, if you are the person or nurse admitting them, their loved one most of the time is their spouse who is at the bedside with them. And a lot of time the patient can talk, but not so much. They're not as great as what we call a historian. These are some things that you can do. Use that spouse to help you perform the assessment. But when you walk in, acknowledge the patient first. Still greet them. They may be someone who is pretty much nonverbal or not talking as much. Still greet them because they are the patient. You want to treat them as a human. Acknowledge them first, but also make sure that you're acknowledging the spouse. That's just key because you want them to feel like, look, I'm caring for the patient, but also you as a spouse, you matter. So when I greet the patient, I have my one-on-one with them, and then I turn around and I say, hi, how are you? Tell me your name. I'm Leah. And then just try to have some type of quick conversation with them to let them know that yes, you are involved in this care as well. So then I try to have an assessment with the patient as much as I can. I assess my patient, I look through their skin, I do everything for the patient. But once I am done, the patient is a poor historian, so you're not able to get all the things you need, and you will primarily be taking care of this patient when their spouse is not there. So these are some key things that will help you. So number one, you want to make sure that that person's time there is as comfortable as possible. It's not home, but you want it to be darn near close to home. So what I do, I say, hey, if at any time this patient starts to get combative or just, irate, what are some things that can calm this patient down? And that's where you ask the questions. Okay, so what are some TV shows that they like? What is some music that they like listening to? Then you want to go into, okay, does this patient, even though they may be a feed, okay, do they have dentures? Is it uppers? Is it lowers? How do they take pills? How do they swallow pills? Do you have to crush it? Do you have to put it in pudding, applesauce? What do they like to eat? What are some favorite foods that may comfort them and make them feel more at home that I can give them? Patient starts to get combative. If we're providing, patient care and they start to kind of get combative, what are some things that I can say that will calm them down? And some of the things I've heard some spouses where it says, hi, I am not here to hurt you. I'm here to help you. And a lot of people, you have to find maybe some phrases or something or a touch that will kind of calm them down. A lot of people I've learned who are MRDD and things of that sort have like little doll babies or stuffies and things that will help them. So try to figure out what it is that will help you as a nurse make that patient feel calm, feel safe, and more at home. You have a patient who's a total or a patient who has some developmental delays, and you have either mom or dad or the spouse, utilize them, especially because your patient is a poor historian. Utilize them to help you as a nurse make that patient feel calm and secure and knowing that you're taking care of